let's see, we're going to need, well, we lost Shannon at the wrong moment. Oh, there you are, look at you. Dr. Musaitif? Dr. Musaitif? I think, well, we still have quorum if she's here, right? Okay, so let's go ahead and begin. Good afternoon. Today is November 17, 2025. It is 4:21 p.m. and as a quorum of the committees in attendance, I'd like to call to order the meeting of the Central Health Infrastructure Committee. As a reminder, a committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. We have public communication. Is there anyone scheduled or signed up to comment for public communication? Thank you, Valerie. No. And with that said,
recording in progress.
Move into the agenda. Agenda item number 1 is to review and approve the minutes of the April 9th, 2025 Infrastructure Committee meeting. Run the minutes.
Do you need a motion?
Happy to take one.
Just going over it.
Yeah, that'd be great.
So this is for agenda number 1.
Yeah, just the minutes.
So I move that the committee approve the minutes of the April 9, 2025 Infrastructure Committee meeting.
Second.
We have a second from Manager May, and just to be clear,
She's not committee.
yeah, and so I just, we're still good with that, right? Okay, yeah, thank you. I just wanted to make sure we're still good. And a second, so all in favor, aye. Opposed? Abstentions? Great. Now, the next 3 agenda items, just to be clear, I want to preface this a little bit. Agenda items number 2 and 3, we are going to first take an open session. And that is because it's our hope to make this meeting as comfortable for the public to consume as possible. And so our hope is to be able to get the presentations at minimum across, and maybe some high-level questions through for the public to be able to view sort of continuously. And then after that, well, you'll notice that agenda item number 4 is also here, and that needs to be in closed session. And so given that, we're going to move into closed session and pick up any questions from agenda items number 2 and 3, and then move into agenda item number 4. Are there any questions around that before we do that? Brilliant. So we can go to agenda item number 2, receive, discuss, and take appropriate action on a presentation on City of Austin Downtown Plan and current update efforts, Central Health's Brackenridge Master Plan guiding principles, and other planning efforts related to the downtown campus. You know, want to preface for the board members as well as those, you know, the hundreds of thousands of you who are viewing online, that this is, you know, at the request of, or, you know, at the behest of board manager feedback, we wanted to get a good historical context around the properties downtown, particularly in the Brackenridge, formerly known as the Brackenridge Tract, and just get an understanding of where we've been, where we are, and this isn't, the notion is not to have sort of an immediate call to action here, but rather this is to catch us all up contextually so that as we move forward with the decisions that we as a collective board will be needing to make, that we're retaining this context, because some of this context is going back almost a decade. And I candidly, when I was requested to visit these notions, I did not have I wasn't informed very well about them. So I'm thankful for this having been brought up, and also thankful to staff for having been able to prepare this contextual presentation for us. And with that, turn it over to Stephanie McDonald, who is our Chief Infrastructure Officer. Is that correct?
That is correct.
Okay,
Thank you.
and Monica Crowley, who's our Chief Legal Officer or Chief Strategy Officer. Thank you, Chief Strategy Officer.
And if we could go to the presentation, one of the things I did do, we provided in the backup executive summaries of the Downtown Austin Plan. And if you'll keep going, there's a presentation there you go. So these are just the backup documents from the City of Austin. The City of Austin embarked on the Downtown Austin Plan, and man, Manager Mawani, I'm feeling old because I was at the city when they adopted the Downtown Austin Plan to start. If you keep going, this is, like I said, one more for me. Okay, so this Downtown Austin Plan was initially adopted in 2011, and since then, I think there were some things that were implemented, there were some things that were not. We can talk about maybe those items if you want to in more detail, but I think what is really important is that in 2024, the City Council approved a resolution to initiate an update to the Downtown Austin Plan, and because the geographic scope has grown, they renamed it the Central City District Plan or the Central District Plan. And if you go one more slide, this really shows you kind of the new geographic boundaries of that Central District Plan. It does go south of the Colorado River. It does incorporate some land, as you all know, that has been in discussion, including the former Statesman property. And I think the idea is that a lot of the things that impact that central city are across this area. They don't stop at the river, right? And then to the right, just so you know, is the downtown campus. There is very little right there in the middle. This kind of is the old, shows you the old building envelopes for the hospital. But in that area in the red that was the former Red River Street, and as you know, we constructed a new Red River, which is in green, bless you, that has been operational. You can drive down it, go through to 15th Street there, and that old, the red block that you see there is going to be a right-of-way exchange with the City of Austin for some additional right-of-way adjacent to the parking garage, since we had to give up some right-of-way to straighten Red River. And then the city recently in October named that red area the Pike Power Plaza in honor of the late Pike Powers. And they are working through the Public Works and Transportation Department on some planning efforts for that property. And they have asked, I've had one meeting with the University of Texas and the Public Works Department to kind of just think about what that opportunity could be. Next slide, please. So the Central City District Plan, these are just some elements of what they are trying to achieve with it. I think the biggest thing right now is transportation, both with the expansion of Interstate 35 to the east, as well as the implementation of the Project Connect projects and many of the transportation projects, including bus rapid transit for that corridor that includes kind of that Trinity area. So I think obviously there's a lot of work going on. I think you all understand there's a lot of discussion within the city and as a community around potential caps over certain areas over Interstate 35. And I think that they know that there's some things that have really changed since 2011 downtown. If you'll go to the next slide, please. And I think one of them is, I talked about transformation around mobility, but also I think just recognition that, downtown has become, and Central Austin has become increasingly unaffordable, but how do we solve for affordability? It's also, one of the prime economic engines of the region. There has been a softening, as you can imagine, of real estate downtown, but many of those buildings, even though they look empty, are actually leased, and so there's lease payments being collected. There's new projects still under development. I think the one that's most impactful to us is right here at on Cesar Chavez, close to Red River. So the convention center being another kind of huge project downtown, making kind of very significant impact to and how we think about the future of downtown. So I just want to let you know that the council adopted a resolution in August of 2024 to create an update to the Downtown Austin Plan. AECOM, which is a firm that's multidisciplinary, they do engineering, design, construction, planning work, was selected. There is an increase in the geographic scope from when we started in 2011. I think they are really looking at additional insights, including demographics, other plans, environmental considerations, other community planning that has gone along in the area, including the Palm District Plan and other kind of planning efforts over the years. I do think that this is something that is going to take some time to evolve. There is a technical advisory group, and I sit on the technical advisory group along with other city departments. We've only had one meeting, so nothing to report out yet on, but I would be happy to do so to this committee in the future as we learn more about what is shaping. Monica, anything specific around the Downtown Austin Plan? Then if you go to the next slide for me. And it culminated in 2016, and this did take, it was a multi-year effort, but we knew we had an opportunity with the construction of Del Seton Medical Center to rethink the future of the former University Medical Center Brackenridge campus. That is about a 14-acre campus. As you know, that is in kind of the heart of that northeast quadrant of the Central District. We did a lot of work. We met with a lot of people. I joined as the kind of the tail end at Central Health, and I think we had, I can't remember how many community conversations, Monica, I know you were involved in a lot of those in your role. We did have a technical advisory group for the Brackenridge Master Plan. We had many stakeholders at the table, and I think, and I did share with you in your backup packet the guiding principles and planning parameters that came out of that master planning effort. I will share with you that we took that plan to market. This was in 2016, 2017, and we realized after we selected a master developer to negotiate with that it was not feasible to get the financial return that we wanted with that master developer, and if that was the best master developer out of that selection process and a highly reputable company, we started to rethink what is our strategy for this campus. And then I think a lot of things changed about that time, and I'm going to hand it over to Monica to go back in the Wayback Machine.
I think also one of the things I think in, and this was all, there was different leadership at Central Health. Stephanie and I and everyone in this room were in different roles at this time, but, so we were not directly involved in taking this plan to market at the time. That was something that was handled by the then Chief Administrative Officer and Chief Strategy Officer and Chief Financial Officer, and then the Board of Managers at the time then, but it did seem like there wasn't going to be the hoped for value in the master plan at the time. And then also as we got into 2017, 2018, 2019, and there were structural changes as services transitioned from UMCB Brackenridge into Del Seton Medical Center across the street, and there was different leadership over our key hospital partner organization. At the time that this master plan was developed, Central Health hadn't, been put in a position to need to go to the legislature to request the ability to provide direct specialty services. That was something that happened in 2019. And in 2020, the Board of Managers made the decision to send the notice of noncompliance to Ascension around services that were being provided pursuant to the Master and Omnibus Service Agreement. And so at the time this master plan was developed, there was a different partnership related to hospital services and services that were being provided, that it turned out we had in 2018 and 2019, and then of course in 2020 and beyond.
So we've provided all of this in the backup. We are happy to answer any questions that we can in the open session. Monica, yeah.
Just want to make sure that I'm at least regurgitating this correctly, and thanks for the presentation. So chronologically, the what was first was the Brackenridge Master Plan, which is also, is that right? No, the 2016 plan?
The 2011 Downtown Austin.
Oh, the 2011 TAP, the Downtown Austin Plan. And then there was the 2016 Brackenridge Master Plan. And now you are in the technical advisory group for the
What is the
district,
Central District Plan.
the central district plan. And the central district plan sort of subsumes what the downtown, what the DAP and the Brackenridge Master Plan was, and it's maybe even a little bit larger.
The city plan does not directly impact, it takes what they refer to as the central health PUD or planned unit development into consideration.
Oh, okay.
Our planning effort was separate, and any, subsequent planning that we do would be separate, but would, hopefully work harmoniously with the central district plan. But I do think, we have a unique opportunity and a mission to serve at Central Health with, our assets, right?
And so then, if I were to restate this, you're serving as a technical advisor, sort of in a liaisonary sense, understanding that the Central Health PUD is, independent of those planning efforts, but of course in the spirit of harmony and pragmatism, and a shared big picture, we're involved together in that Central District Plan planning. And the 2016/2017 Brackenridge Plan, when we say we took it to market, does that mean that basically it went out for RFI or qualifications or proposals? Okay, and through the rubric, master developer was selected, but through the lens of this master developer, or through the basically through the lens of the implementation plan, if you will, if we simplify it, of this master developer, it was determined that the financial community benefit, if you will, didn't appear that it would be there over the long term. And so, did I
Absolutely,
hear
for a very long
what?
time.
And that assessment was based on kind of already hard laid down metrics, or okay, well, that's the extent of my questions, and so I will go around.
Whichever you want to go to first.
Dr. Musaidov?
Thank you for that presentation. I remember that's when I first moved into Austin, and I was probably getting to know about Austin and Central Health through the Brackenridge. So it brings back home many instances. So giving the brief history that I have and the engagement, I believe this is perhaps something we should revisit in a more of a community engagement, because right now the environment has changed. Our views have changed. The market also has evolved. I know there was a momentum at that time to do something with the property, in which we should, but there was a lot of back and forth, and right now we do have a portion of that property that has been leased. Remind me of the, it's Goddess,
Sure. Block 164.
Yeah,
If you go, maybe, Valerie.
Goddessman.
Yeah. It's the 2033 Higher Education
So,
Fund.
With
But
the
it is
20,
of its supporting
I
team.
recall that instance with the 2033. They do have that leased. Actually, I was recently invited to tour that facility, and the team highly encouraged the board to come and visit because this is our property and it's a really beautiful property. And they have one, I think it's on the 14th floor, that they actually are open for it's a community engagement if there's anything that we ever need to host an event at this property, and all we have to do is coordinate with UT, and it's free of charge for Central Health. It's really a really beautiful property, and I encourage everyone to go and visit and see what it is, and they actually invited, and I'm sorry for forgetting to relay that information to the board. But really, the overall comment is we may need to re-engage the community back because a lot of this has changed, and there was a lot of work and momentum during that time that I don't really remember a lot, but I remember the energy that was poured into from the community.
Thank you, Dr. Musaitif. It sounds like, we're hearing an appetite to potentially re-engage around community sentiment as related to that tract. Manager Jones?
Yes, I'd like to piggyback off of what Manager Musaitif said. I think that would be a good idea, a good strategy. I was on the board, actually I came on board in 17, right, as a lot of this discussion was. And one of the biggest questions, as I can recall, is the whole question of what benefit to the greater community, meaning outside of the downtown area, with this brain. Would we be basically recreating a high-scale community where people would not be able to get health care? I think that was the CTE, or that's on 15th and
The CEC.
yeah. One of the questions was, well, we're going to use that. Part of the question before BRAC even was torn down was, before we tear it down, what are we going to do with it? So there were a lot of dialogue and discussions in the community and at the board as well. So I think it would be a good time to go back and revisit that. One of the big issues I remember, one of the big things, one of the council members said years ago related to this area is that there should be nothing built so tall that people in the eastern side of town could not see downtown. And even though that is long probably been not looked at, I think there may be some desire to look at the hook end between what the east and central parts of town, particular population. Even though it's being gentrified and being dispersed, there are still going to be pockets of populations that can benefit and should be able to have access to services in this area. So that would be part of a discussion I would encourage as we look at what we want to do.
Looks like two of our members are interested in re-engaging around the community sentiment, and particularly through the lens of connectivity, both likely mobility-wise, but culturally, in as much as the connection to the east and the central parts of town. Does that sound right? Yes. Are there any other questions or thoughts? Chair Kitchen?
I just have a question about sort of where it stands right now. So, if I heard you right, the board approved, is this right to say that the board approved the Brackenridge Campus Master Plan in 2016? Okay. Did the board then vote at a later date to not pursue? What did the board, how did it stop?
I believe they did vote to not pursue further negotiations, but I would have to go back and try to confirm how that action was.
Okay, I'd just like to understand. So is it correct to say that, so the board ended it somehow, okay? And y'all will check for us and find out when that was and what that vote was. And so there's been no action on this master plan since then, is that right? Okay, and then the other question I have is, this is a PUD, right? Was the, I can guess, but let me ask you this. Was the PUD approved, the zoning for the PUD, was that approved by the city?
Yes, it was.
Okay, so we have approved PUD, and that approved PUD would give us the parameters for what we could build within, unless we go back and change it. I would like to understand what's in that PUD. So if you could, and for everyone else, PUD's a planned unit development, y'all may be familiar with it. It gives you the parameters on what you can build for zoning purposes. Now, it's, it's not real precise, but it does give you the bigger parameters. And there's always a community benefit that has to be provided as part of it or to get approval of the PUD. So I think it would be helpful for us to understand what was approved, so maybe you could provide that for us. And then the last thing I would say is I too would be interested in re-engaging.
Okay. Thank you, Chair. Manager May.
Thank you. And just to further second what Chair Kitchen just indicated here, I would be interested in learning, as a result of this PUD agreement, is there an ability for us to do mixed use as we develop it? And then I'd like to know what the affordable housing component might look like.
We can provide that to you as the PUD, as part of the PUD ordinance.
Yeah, I figured it would be part of it, but I want to get a handle on that because we've had some PUDs that have, citywide, we've had some PUDs that have gone out, some developments gone out, and the PUDs have not met the standard of the affordability criteria. And I'm interested in understanding that better so that we can be better decision makers.
Manager Rodriguez, were you picking back on what Manager May was saying, or sorry, then I had overlooked Dr. Martin.
Never again. Hey, I was, I have a question concerning the development. The real estate people that came to visit with us said that the $500 million value of this property is based on, to some extent, that there was really no limitations on height, that was an enormous valuation for the project. Is that still correct?
That is correct. Now, it is always tempered by what the market will bear, right?
Correct.
So timing is very, appropriate.
Right, but that was a restriction that was unique to this property.
There has to be a limitation on height in the PUD.
It's 25 to 1 FAR, I believe. So it's the tallest FAR right now that has since changed a little bit, but I still believe it's one of the, that's the, biggest FAR of it.
Well, the PUD will have a limit on height. Now, whether it expresses it as height or FAR, I don't know, but there
25
would
to
be
1
a-
FAR, I believe. Yep.
Yeah, but it was pretty extreme.
Yeah.
That's what I get.
If I may just really
Sure.
recall, I think the limitation was also capital view restrictions.
There's
So that was
a very small sliver that has a capital view corridor over it, and then that, of course, does limit. There is some discussion in the community also about those capital view corridors once the upper deck of Interstate 35 is removed, because that is where they are calculated from. And I do know that is something that is up for discussion, and that's probably something that will likely come up, if I can guess, around the central district planning.
Thank you. And Manager Rodriguez?
Yeah, thank you. I just had a quick question around the fact that Central Health is investing $1 million with AECOM around this
Oh, we're not,
multi-phase.
yeah. No, that's the
Who's
city.
doing that? The city is?
is.
So where are we anchoring our strategic direction? I think the documents, from a governance perspective, like the documents this board needs is both the Capitol View corridor requirements, so they understand what can and can't be done, because that's state law that State Representative Lloyd Doggett at the time passed in the legislature. A real estate policy about what the highest and best use is of this area, because since we did not move forward with the master plan, and then the PUD, as that kind of gives you the, as folks have already said, kind of the limitations. Are there any other governing documents that you all are using that Central Health has passed, previous boards of managers have passed in terms of direction for this particular piece of property?
And so far for this particular piece of property, it has, since the board had decided to pause or put on hold this prior master plan, I think since there were actions that the board took that we can research kind of the timing of, that included the lease to the 2033 fund of Block 164, which includes the completed building that Manager Messiah Teef was mentioning, and part of Block 167. The additional work that's been done has been more on a needs basis. So around what's the development that's been done at the CEC, that was based upon needs that were, brought to this board around needing to ramp up one of the phases of the strategic plan, or the service delivery strategic plan, which is the healthcare equity plan, which is really the grounding document that any of the decision-making about, properties or service delivery development are based upon. So the community came to us a couple of years ago saying that they needed respite care quicker than it was kind of laid out in the service delivery strategic plan. The CEC became available, and it was determined that we could, within about 6 months, add 40 respite care beds. And we brought that to the board, asked the board for permission to ramp up the service delivery strategic plan implementation and use that for development of that CEC block. But we haven't gone back since there was a, pause put on implementing the original master plan, and revisited the uses of this property in a way that might include, there were no medical services contemplated in that original 2015-2016 plan. And so there hasn't been, even looking at it based on the guiding principles that were developed earlier, revisiting of that plan, like many of you are mentioning today, that seems, very reasonable. Yeah.
We just might want to talk further about that under number 4.
Thank you. Because from my perspective, like a strategic plan and the equity plan, which seems like it's also a strategic plan, if there's one strategic plan and how you are anchoring and what direction, what you are using from the board to do the things that you're doing. Yeah.
Yeah, I think.
Thank you.
We can talk a little bit about follow-up.
And Manager Jones? Thank you.
Yeah, part of the discussion, as I recall, now this was as I came on board, was that one of the reasons we went into a pause is because the board members at that time was very much interested in ensuring that any investment was made, that some of the resources that came out of it would be used to be able to facilitate health services in other parts of the community. Not necessarily there, but other parts of the community. And so we needed time to talk to the community, get input and feedback from them before we go forth with plans for this area. And so I want to emphasize that, because it's like, we don't want to just give this property away and then there's no benefit to the community as a result of that. And so that was one of the factors that went into the pause discussion.
Thank you. And so when we're getting the context around when we, pivoted away may not be the right language, but when we, at least if anything in practice, started to move away, whether it was by means of the analysis after the master developer was selected, or simply by means of our trajectory. If there's any specific board actions and any contextual discussion that might be helpful, then I think that would also be great to package in there. Thank you, Manager Jones and Chair.
Just a follow-up question. So, and this might build off of what Manager Jones was saying. So I was trying to understand the relationship with the health equity plan. So between the master plan and the health equity plan, but maybe it was a pivot to the health equity plan to try to figure out what the community needed. Is that what you think it was?
Well, it was the early stages of doing that.
Oh, okay.
So, because the belief was, well, if we're going to take these resources, we need to be able to make sure that equity occurs for the community, the greater community. And so from that, health equity began to move along.
Does the health equity plan, I don't remember, does the health equity plan say anything about the use of the Brackenridge campus?
It says that we are exploring the It doesn't specifically mention the Brackenridge campus. It talks about the type of service delivery that includes an exploration of how we will ensure that patients across the community get the best access to acute and hospital services. That is a nod to, how this property might or might not be incorporated to ensure that we have either the resources or the space to make sure those services are provided. But it didn't explore that next level, but I think in item number 4, we could talk a little bit more about that.
Okay, because it might be one of the documents that Manager Rodriguez is asking about that guides, one of the board adopted documents that guides what we might
Yeah.
do with the property. That's really where I was getting to. And then the last question is, the master plan, is there it sounds like there's a master plan itself, document. Did the board adopt that master plan document?
They did.
Okay, I think, Chair, I think it'd be useful for us to have access to that. I don't know what we're talking about in terms of the level of detail in it, but since it's a board-adopted, well, it's a board-adopted document, so perhaps there's a summary or something, because it would be one of the, would be one of the documents that guides us, one of the documents from the board that guides us, unless we just want to throw it out. But if we're re-engaging, that might be a place to start.
And that's why I did include the guiding principles and planning parameters from the Brackenridge Master Plan in your backup packets.
Okay, but is there more to it
I
than that?
absolutely can share more.
Okay, thanks.
We still have copies of the actual, I think if you remember, they were kind of the very large format, not super thick, but large format. It's beautiful. If we still have copies of them, we'll
Okay.
give you paper copies as well as electronic copies.
I'm mostly interested in the uses, okay, thank you, Chair.
Heard, thank you.
So one little clarifying point related to Manager Jones. The property itself does not have to be dedicated to the delivery of healthcare, but the assets could, for example, be used for delivery of healthcare.
Correct. I think it's important to remind the board that, the lease payments that we were getting from Seton for the use of the hospital were, significant. And so we knew that we would not have that source of revenue. Now, we do still lease the parking garage. I'm happy to report, I don't know if we've reported back out yet because it just happened really recently. We did renew the lease and have executed a new agreement for the parking garage that supports Del Seton Medical Center. But that was also, just to point out, part of, one of the things that we were really trying to solve for.
Thank you.
Okay, well, I think we've heard, yeah.
Well, I'm happy about the garage. Has there been any changes to the contract from the previous
New
years?
rate, better rate for us, and it is for a shorter duration. So, yeah.
Thank you.
Yeah.
So what I've heard from that discussion is that there is a substantial appetite in this room and on the committee, at minimum, for the board to re-engage around what's now called the Central District
Well, the
area.
Brackenridge Master
But yeah, let's just call it the Brackenridge Master Plan for the sake of common language. But for the board to re-engage around that through the lens of updating first of all, re-examining community sentiment that was documented in the documents that were evaluated, particularly in 2016 and between then and now, through the lens of fostering both cultural and infrastructural continuity, on that tract between the east and central parts of town, and through the lens, of course, of harmonizing any master facilities plan with our health equity plan, and/or determining what kind of North Star strategic plan that might potentially comprise. Not that we need to do all these things, but open up, just kind of reopen like this engagement, if you will. And so I would like to move that we, yes, Chair Kitchen?
I wanted to add, there were 5 documents we requested. So.
Okay, and there were 5 documents that were requested. I
You want
believe
me to
that,
go through those, or-
I believe the document was the actual full text of the master plan that the board voted for, the actual PUD, and any implications as related to the Capitol View corridor on that tract, and any official vote that moved us, that potentially moved the board, the legacy board, in a different direction from the master plan that was adopted in number 5.
Was if there's a relevant real estate policy.
Oh,
That's
and
driving this.
if there's an applicable real estate policy that's driving it.
Along that request also came what Moran brought up, which was the Capitol View policy.
Yeah.
Oh, you did? I'm sorry if I missed it.
So, again, the motion was to recommend that to the board, and so I will present that motion.
Second.
Got a second from Manager Musaitif? All in favor?
Aye.
Aye. And it passes unanimously.
And maybe just to clarify for David's purposes.
The wording.
The wording of the motion?
Yeah, sorry.
You're recommending to the board that you be provided with those 5 documents?
Recommending with the board that we reopen engagement on
Yes.
this through the
Oh,
lens
okay.
of those principles and through the provision of those 5 documents.
Yes.
Sorry about that, David. I'll be more thoughtful next time.
Just one thing, would you want to add a timeline around that?
Well, I think the board next week. What do you suggest?
No, at least I think having a timeline at the next meeting or whatever time frame, so it can be more deliverable rather than it's an open item. That's just a suggestion if you would like.
Yeah, I'm open to the notion. I would like staff to think about what it might take to do that, and maybe not have you all on the spot to do that. But if you want to suggest a timeline now, great.
I want to suggest that we divide that into 2 parts and that we come back as soon as, I believe we have a December meeting plan for the infrastructure committee with any relevant documents that we have and any information about historic actions taken by the board, and then potentially a proposal on what this, any future engagement could look like.
And I think we were aiming for the December 17th board meeting, so I didn't know that was a,
Got it.
yeah, I would say not a
Okay.
meeting
Specifically for the infrastructure
before
committee, sure.
December 17th. I mean, it could be infrastructure committee, but, yeah.
To do that.
Isn't that too early to get all that
Yeah.
information?
Well, we can get the documents, we can't do the plan
Yeah,
necessarily.
No, I don't expect. Yeah, I wouldn't expect the
Yeah.
great. I think. Well, we have a good representative sort of cohort from the board here. So what I was hoping for was that, if it were on consent at the board meeting later in the week, that we would talk about it there. But it seems like we're qualifying it now. So yeah, if we can get those documents back by the next meeting, and then the next meeting we could discuss kind of the further engagement timeline. Yes, Chair Kitchen?
I have a suggestion. This motion can go on the board meeting, upcoming board meeting. In terms of timing, the other thing that's on our upcoming board meeting is a table of board governance decision-making. And y'all will get that today, yeah. And it has a column for timing on it. And so I'm going to suggest that we add approved updated Brackenridge master plan as a line item on that table, and then that provides the opportunity for everyone to think about what the right timeline is for that.
Just to clarify, approve Brackenridge master plan, meaning
Updated. Because what you just talked about was re-engaging on the planning. So I don't care what we call it. You might want to call it an updated Brackenridge master plan, or you might want to call it something else.
Yeah, I don't know what we would want to call it, given that there's a master facilities plan happening as well. And would that be a subset of that, or a corollary of that, or like?
thing.
Yeah.
It's a subset. It's got to have its own. But anyway, you can think about it.
Yeah, okay. So for now, the motion as it stood, I think is fine with the knowledge that y'all will be bringing us some documents at the next infrastructure committee meeting. Good.
One last
All right.
comment is that at the meeting, I would encourage, if possible, we could invite to be, when we discuss it, some of the board members who were part of the process in developing that, because I think they can bring a value. I know Manager Valadez isn't here tonight. I know she was here. Manager Dr. Zamora was also, and I think I'm the lone wolf who has some history there. But I think that might be something to have available if they're willing to, just to add some historical value.
So, yeah, happy to do that, and I think you should feel free to invite folks to the next committee meeting, either speak at public communication or possibly be available for a presentation. So I encourage whomever's in touch with those folks to do that. Thank you, Manager Jones, and let's, it does not look like we're going to be reopening this item in closed session. Let's move on to agenda item number 3.
Sure. Valerie, could I ask you to advance to the map? Oh, sorry, go ahead.
Could you
I
read it?
am.
Okay, he's,
Which, agenda item number 3 is to receive and discuss a presentation on current Central Health System owned and leased assets. And as we move into this presentation with our same brilliant speakers, it's important to me to share that we've heard this board asking for very specific items over the past quarter, and we haven't had an infrastructure meeting then, and I feel, I feel like it's very important that I, number one, apologize for any shortcoming and not having been able to have gotten this information to our board. I really do feel like we're kind of inventing the wheel on what we wanted as we were saying it, to be fair to me a little bit. And that said, if, I were a leader in the field, or maybe the best of the best of the best of the best in the field, like maybe, then I would have exactly known which, specific notions we would have required for the kind of real estate and infrastructure plan that we're looking for. And that said, the board was generous to be able to provide many suggestions around what we feel like we need to be able to feel comfortable moving forward with real estate related decisions, especially through the lens of community need and being able to serve our mission. And I want to thank staff for being responsive when I said, okay, I know I asked for an at-a-glance last time that had all of our properties, what we were doing with them, and when we thought we would be out of them, but it's what we need more than that. We're going to need sort of the startings of a map. That's something that's been asked for. We're going to need to really, really get a clear understanding, one that's technically complex and possibly lay simple, around how to evaluate, first of all, how to predictably forecast, our circumstances with buildings on lease, and when those terms are up, and be able to use that data as criteria in our decision-making frameworks. But secondly, when we're looking at how to address needs, particularly occupancy needs, that we have some sort of paradigm that's or mechanism so that we can measure the value of going potentially with an owned property or with a lease. And in a lot of our minds, in the back of our minds, the relay is, of course, owning the property is better. And that said, having calculations that and perhaps tables that show us what this looks like, what net present value is, what it could be, at the end of a potential lease term versus at the end of a potential, mortgage term kind of thing, and how those would compare. And I know we've seen those things in some way, form, or fashion rolled up in presentations, from our finance team. But having those elements more discrete and perhaps more specific to properties, especially comparatively when we're looking at comparisons, is going to be valuable. And another thing I heard, in addition to just being able to understand more our leasing situations and the predictability, is understanding the implications of the upkeep cost, both of owned property and leased property. So the M&O through the lens of the budget, but and if that can somehow be itemized a little bit more, or at least maybe if not every time, but for the purposes of our discussion, contextualized a bit more. Again, so we can see what applies to leased properties and owned properties. That I think that would be helpful. And finally, understanding the demarcations between Central Health leased and owned properties and community care leased and owned properties was another bit of feedback that I heard. So I want you all to know that I've heard the feedback. We may not be able to operationalize that immediately. I've worked with staff. I discussed it with staff, and staff have responded, no, this is all completely reasonable stuff. We can work on this. We can get it to you. Let us marinate on the formats. Let us get a first iteration out at this next infrastructure committee meeting, so that folks know that we're all operating together in good faith. And I'm just going to ask, that the team be thoughtful about not throwing things at me if we don't meet your satisfaction today. Just know that we're working to improve, and so I'll thank you all with that, and then we can move into the presentation.
Ditto everything that Chair Motwani said. So we're sharing this list of current leased and owned sites. So we've heard from you all that we need more predictability in forecasting both our investments as well as cost maintaining our physical sites. So as you can see, this is, and I'm sorry, we are working to refine this. This is something that is actually more challenging than you might realize, but what we have is, most of, what we consider the Central Health System sites do include community care's leased sites on this map. The green lines on the spreadsheet, which you also have, denote the leased sites, the darker green being what is leased to Central Health essentially, and then the lighter green, the paler green to community care, and as you can see, that list is fairly significant. We also include, because technically they are leased sites, the original City of Austin map sites, East Austin, South Austin, Rosewood, Zaragoza. Although we only pay $1 a year in rent, Central Health is responsible for the capital improvements of those sites, and we have about a little less than 10 years left on those original agreements with the city. 2034, we have open discussions with the city to extend that an additional 10 years, specifically to Rosewood, Zaragoza. And I think you will see there's a small group of blue lines in the kind of pale lavender. Two of them, I will admit, are the ones that are pending acquisition, just because we didn't want to leave them off, so that you knew that we had them on our radar. And I think you will also see in the very far right column that we do have some what we're calling building assessments. This is done by an outside party to come in and see what the building infrastructure, the systems, just the building envelope, any things that would be part of a future kind of building update that would be needed for the biggest sites that are owned, North Central and Southeast Health and Wellness Center. And then we are also going back in and reviewing the work that was done at Rosewood, Zaragoza, because we want that additional 10 years from the city. Want to point out that although the geographic range of coverage that we can provide in the ambulatory system across the county and even outside in a couple of locations looks considerable, many of the sites are small. They are very, there's actually still a couple of single provider sites, and there are places where there's just a very small group of providers. We have, of course, the AOB sites, the Austin AOB sites in the community care portfolio, and the Carousel pediatric sites, which are usually a little bit larger. So I'm happy to answer any questions you have about the list and the map. We are working, as Chairman Wani put it, stated, on trying to create a more fulsome tool so that you understand where we are at. Also, I did provide some initial high-level terms of the lease sites, but limited knowledge about the specific terms of the community care sites, but would be happy to answer any questions.
First, thanks for this. This is a comprehensive list, if I understand right.
For right now, yes.
And though I know that we didn't get it, every single one of those variables mentioned, I do at least see, the determination dates of the leases, the square footage, which I think is important, and then, of course, notes and allusions to uses. And I think, we're definitely going to obviously have more dimensions that we want to see it through. And the first question will go to Dr. Musaidov.
Thank you, appreciate it. So I see that there's 12 properties that for Central Health are leased. 2 of them, well, one will end this year. I just wanted to understand, in terms of planning. 1 ends this year, 2 ends next year, and 3 end the following year. So do we have a plan? You don't have to go into the plan right now, but is it yes in action?
Yes, and then there are times when we can discuss a renewal option or extending, the terms of the lease. And so, for example, Capitol Plaza is one where we've just had some discussions this past week with the owner. We were kind of waiting to see what the TechStop project
Is all this
would
comfortable
pass.
for open session?
Yeah,
Okay,
this
thank you.
is, just
Sorry
so
about the
you know,
interruption.
it's all, for us, it's public information for the most part. So I will share with you that, so yes, we are having, we are making active plans to try to solve for those locations.
Okay, and for CUC, I see they do not own any properties. So there's 13 that are leased and 4 end in 2026. Is there active plans?
Possibly, and I do not want to speak in detail because I have limited insight
Okay,
into.
that's perfect, that's fine. And in the future, if possible, and I see our data folks here, could we include a column of the population of each of the county areas that you're serving?
Patient population
Yes.
or the
Or-
the demographics around that area?
Patient.
How many patients are currently
Well,
using?
who are,
How many are you serving in those
yeah, how many are
facilities?
serving?
And how
the
many
potential
patients, the patient template sizes for
that
each of those?
qualify, maybe that qualify for our services, because I'm really interested in terms of the capacity of those clinics and the services, those specific,
Sure.
services of
I'm
each
not
clinic.
sure, I will have to work
So I was
with,
wondering if that information, I don't know if you can answer, if that's something that you can add to here. I believe this is an evolving document, but that will help us as we're planning our master plan to understand what needs to be done. And also as I look at this map and what really stands out to me, there's a significant portion in this area, there's no services. So that's also something that
and
we
I'm
need
sorry, we should probably put, this was done in a other system, but we should probably put the county lines. They are on there, I believe, in purple.
Where?
Oh, no, they're not. We need to, so we had to be able to show the geography span from all the way up to Round Rock, all the way east to Bastrop. So this exceeds beyond the Travis County geographic region because of those
But
two
there are
sites.
still some areas within
Oh,
our region.
absolutely.
Yeah, absolutely. So again, I'm just thinking this will be helpful as we're adopting and planning our real estate master plan to what service, where we need to allocate those services in terms of priorities as we're in the future, if we're acquiring any new facilities. So just based on the data and that you'll be able to provide, so we can actually see how many patients may fall into our, qualify for our services, and what is the capacity we have, and what services are we providing in that specific geographic location. So that's really what I'm hoping we can, that you can provide us as we're making these decisions in the future.
And thank you so much, Manager Musaidov. I saw JP nodding when you had to ask about adding the column specifically for patients that are being served in each facility as they exist. And then also, we will be bringing to y'all soon, I think within the next couple of months, we're going to be going out for RFP on the combined safety net community health needs assessment that we're doing with community care. And part of that needs assessment will be this update of, so we can share the information from the demographic report about the population where it was, I think, 2 years ago. We are updating that needs assessment specifically with information about where services provided, what access there is, and what those needs are as part of that joint Chinook exercise.
Awesome. So what I'm hearing is patient services region, if and when we get the ability to link to data sources to be able to do that, great. Even though the data may not be as up to date as we wish, it is an iterative beginning, so that's a good thing. And great point that you brought up, Monica, which is that the needs assessment is coming up. And when that happens, that will also inform this constellation of documents, which are all connected. And so I do think it would be helpful for us to have a mind map somewhere that shows, health equity. But this is getting out of my purview a bit, obviously, but at least in as much as the IC infrastructure committee related documents, a mind map to all of the community activities or other activities that may bidirectionally inform the master facilities plan, as it were. So thank you all for that. Do we have any more questions or thoughts? Manager Jones, Manager May, Manager Jones.
Okay, I concur with my colleague with regards to the column outlining population. But I also am a little concerned in the fact that, and I'm glad you have this. You visually look at it for those of us who are very concerned about northeast part of the county, and when you overlay the mortality and morbidity data that we see in southeast and northeast, well, we've invested in the southeast. We've built 2 new facilities. We're about to build one in the northeast. But the city of Manor particularly is one of the fastest, if not the fastest growing city in the county. And so the question is, are we looking at trends of demographic changes of population and timeframes of which that are occurring? I know that in Manor we have a sort of a stopgap facility there. But I'm just wondering, are we looking at what's happening there? And not just Manor, but also the surrounding areas that are east of that. That Elgin, which is now in parts in Travis County, and Seal, which is another area that is rapidly growing there along with New Sweden. These are areas that probably over the next 10 years will be your new areas that we're talking about now. So I'm just saying, are we looking at that type of thing?
Absolutely, and
Because I've been on the board 8 years now, and that's a question I keep raising, and it takes us so long to get there. I'm not saying you all, but it just seems like it's a problem that we can't keep up with the trends.
And if I could jump in really quickly, I also want to point out, just so y'all can keep it in your pocket, you probably already know, I believe that there's a survey that's a community needs survey that may be happening in Manor right now. And I think it's a health related survey, and I know that it's IRB sanctioned with ACC. If anything, I know reaching out to the Black Men's Health Clinic, they'll know what's going on with it because they're on the pulse in Manor. But that's just one subset, I think, of the areas that Manager Jones was mentioning. So I don't want to take all the oxygen in the room on that. And if there's anything that y'all have to share in response.
Many in the room know that we actually have, the 2045 projections from Travis County's Long Range Planning Group. It's one of our guiding, documents. So yes.
And I can tell you, Manager Jones, that that your concern around Northeast Travis County has been inculcated and adopted by many around this table. I know that you'll stay engaged with meetings, but you know how to find every single one of us and where we live, and so I expect that we'll be carrying your torch of advocacy. Manager May?
Thank you. It would be helpful to me if we could have this map indicate where our county lines are.
Yes, absolutely, that was
Yeah.
something that we, will try to do for the next iteration.
Yeah, thank you.
Absolutely.
If I may respond to, one of the challenges, particularly on the eastern part, is that Elgin, 290 corridor. Elgin now has a jurisdiction in Travis County. And so that line is important to understand, but recognize that services are provided by us in this county for citizens that are in this part of the city of Elgin, and other cities too, on that corridor.
Thank you. I think we're, Dr. Martin?
Yeah, so Manager Musaitif, I think all the data about populations was given to us about 6 months ago with a great big layout of the county about where the populations we're serving are, which is part of the reason that Northeast purchase is so important. It's glaringly obvious to all of us that Maine is vastly underserved and is the future, but I think that data has already been presented demographically to us. If you look back on the stuff we were given, that enormous handout we were given about the population. And that was the purpose of the purchase of that clinic in the Northeast, was to sort of unify that because the number of patients that are being served up there. So I think it is available already, but I think certainly moving forward, Shannon, the next 10 years are key out there, so thank you.
Well, we have an HEB out there now, so you can come out there and sit and talk.
Well, if I may just really quickly, I do recall that data, but I'm just thinking as we're making these decisions, if it's all in one place, I know it's scattered here and there, just a one living document, that it's accessible to us. That's what I'm hoping.
I hear you. And so with that said, I'd like to close this agenda item off for a couple of reasons. The first, of course, is time. The second is that there's dinner next door. It'd be great to grab dinner. We may lose a committee member in a half hour or so. So let's grab a bite before we go into closed session. If everybody is comfortable with it, and I'm leaning kind of toward my chair right here, I think that the feedback that was provided was relatively constructive, and we don't need a motion around it. It was around just continuous improvement on the deliverable that y'all brought to us, and thank you all for that. So with that said, I would probably need to read something.
It's in your script.
Do I need to announce the convening and closed?
Yes,
Okay.
just read the agenda item and then read all that.
All right, so agenda item number 4 is to receive, discuss, and take appropriate action on an update on the development of a comprehensive facility master plan. I announce that the committee is convening in closed session to discuss agenda item 2. Oh, actually, we'll just
No, just
we'll
4.
just be clear because we're done with 2 and 3. To just discuss agenda item number 4. Under Texas Government Code 551.071, consultation with attorney, and Texas Government Code 551.072, deliberation regarding real property.
Time and date.
And the time is 5:28 p.m. Okay, the time, or the date is November 17, 2025. The time is 6:29 PM, and I would like to go to agenda item number 5, or we're back in open session. I'd like to go to agenda item number 5, which is to confirm the next infrastructure committee meeting date, time, and location. We have not currently scheduled such infrastructure committee meeting. That said, given the discussion today, we will be getting back with staff as well as board members, clearly board leadership, to determine when's going to be the best place, date, and time for that meeting, given the discussion that's required. So until then, wait a minute, do I need to ask for a motion to adjourn from somebody on this committee? I'll second that. All in favor? Aye. We're out. Thanks.